We have a patient ambassador with us today, John Torrence. John, you've written a series of blogs about your lung health journey and the long road you experienced to diagnosis of bronchiectasis and NTM lung disease. Are you willing to share a little bit about that with the audience?
Of course, Ruth, and it's my pleasure to be here today. I was an otherwise healthy middle-aged man. I started coughing about the time of my 50th birthday. At first, I thought it was just a cold or a flu, but after a reasonable time, it didn't go away. I thought maybe it was environmental or diet or allergies. So I went to the drugstore. I tried every single cough and cold flu medicine that I could find. I looked up things on the internet. I tried everything I could for 2 years, and it didn't go away. But I realized that there was some kind of pattern. So I went to the doctor finally in my 3rd year of what now I call a persistent cough. I realized I had received multiple diagnoses of pneumonia from the various general practitioners I had attended. They prescribed treatment with short doses of common antibiotics, but I never found any relief. By the end of the 3rd year, I was coughing constantly. I could hardly catch my breath at times. It interrupted my ability to get any work done. I got frustrated and I just decided I'm going to go to the clinic and I'm going to talk to somebody. So without an appointment, I went in and I insisted on seeing a doctor. She was very patient with me. She did an x-ray and she found something called a nodule on my lung that she thought might be an early lung cancer. And that was enough to get me referred into the pulmonology department. More tests followed, and instead of finding cancer, they found this disease called non-tuberculous mycobacterium, or as we say, NTM. The doctors at this level never mentioned bronchiectasis. They started a routine for NTM. But some of these terms and medicines that they talked about sounded strangely familiar, even though they said it was a very rare disease. I asked my mom about her lung condition, and sure enough, it was NTM and what she called bronchiectasis. So I asked my doctor if I had bronchiectasis, and he eventually said that I did. I'm convinced to this day that he was not familiar with bronchiectasis, and he had to look it up as I was asking him about it.
Thank you, John. Could you summarize the symptoms that you experienced so we hear them together?
Well, the one that I noticed most was that persistent cough. And what I learned in the medical world is it's okay to have a cough for a cold or a flu, but when a cough lasts longer than one season, for instance, the doctors refer to it as persistent, meaning there's something else going on. That was what I noticed. Now, what else was going on that I really had to think about? I had fatigue, had weakness, weight loss, and night sweats. But again, it's real easy when you don't realize you have a disease to find excuses as to why you're fatigued, why you have weight loss. So it was the doctors that finally recognized those symptoms for me.
How many providers did you see until you got your diagnosis, in summary?
Oh my gosh, I saw at least 3 different primary care physicians through the healthcare plan that I was involved in over that 8-month period during my 3rd year before I was finally referred to a pulmonologist. And the pulmonologist, he oversaw the testing for NTM and gave me the diagnosis. And the testing was found through both a sputum culture and a bronchoscopy. And he referred me over to the infectious disease department. Now, keep in mind, NTM is not an infectious disease, but these doctors are excellent at putting all the cocktails together, the various drugs, and overseeing it. I can tell you the doctor I saw was the smartest person I've ever met up to that point. He knew how to treat every kind of crazy disease. And he said he'd only seen this version of NTM 3 times in his entire career. He wasn't comfortable being the one to give me a plan of action. So he said, I really need a referral to one of the national centers. And he did specifically mention National Jewish Health. as an example of one of the best centers in the country. So I started immediately making phone calls to see how I could get admitted to National Jewish.
Thanks. What treatments did you receive?
Well, the local infectious disease doctor started me on doses of several antibiotics, and these were according to standard. Later on, I found out there were standards in the industry for each different species of NTM. So he followed the standard protocol. It included intravenous medicine, it included inhaled medicine and oral, a very long dose, and it kind of takes a toll on you, but after a while you can learn how to live well with it just by adjusting your diet and your supplements. And so we stayed on that routine for a few months while I waited for the referral to come from National Jewish Health. And eventually my healthcare plan, National Jewish, worked it out so that I could go there. And National Jewish has an in-house system, so you go there for a week or 2 weeks, and they essentially repeat every test ever done, and they come up with a conclusion right then. So I saw an excellent team of physicians and surgeons there at National Jewish.
And then you had surgery.
I did. I ended up having lung surgery. And the interesting thing was, the surgery was really because of the bronchiectasis, the part that my original pulmonologist didn't even tell me about. The bronchiectasis essentially serves as an underlying condition that allows the NTM infection to get worse. They found that my right upper lobe was particularly bad with the bronchiectasis, and they thought by removing it, then they wouldn't have as hard a time controlling the rest of it.
And did that
the NTM?
Sorry.
Well, no, it's okay. That with the drugs did eliminate the NTM infection for the time being. Unfortunately, my lungs are still just a hotbed of activity for infection. So I have had more infection cycles since then, but at least I know now what the cycle is. So it's not quite so scary going to the doctor anymore. I just have to decide I'm going to take the medicine and do the treatment.
Thank you. So it's been quite, it takes a lot of dedication to take care of your medical situation. Do you have time and energy to do anything else? I know that you do a lot to do the airway clearance exercises, and especially while you have an active infection. Do you have any time to do anything else?
Well, to your point, the airway clearance does take quite a bit of time. So I have to dedicate myself to that because that's important to do that on a daily basis. And I tell other patients that on a regular basis, that you need to keep clearing things out of your lungs. But I make a point that I do want to get out and do activities. I'm going to keep doing the things that are important to me. I still do a little bit of work. I volunteer. I take part in family activities. I don't want to be somebody who just sits at home all the time and has a disease as their only asset, if you will.
Thanks, John. You're really inspiring, and you have such an incredible story of perseverance and participation, shared decision-making with your clinicians on how to manage your health. What advice would you give others experiencing symptoms of bronchiectasis or other lung diseases?
Well, what I've learned is you need to be your own best advocate. If you look back to when I finally got the doctor's attention, it was when I went in because I was frustrated. And maybe they saw the passion. Maybe they saw my emotional state that this guy really needs some attention. So you need to be the one that tells your story. Nobody knows your story like you do. You know, in the time that I grew up, we just went in very passively to see a doctor. And now I'm saying it's different now. You have to go in and actively participate with the doctor. So document the diagnosis and treatments that you're prescribed. Record what works and what doesn't. Report your findings to the doctors in a logical way so that the doctor can see the progress you're making. And don't accept having to cough for 3 years. That's not normal, it turns out. Do your research, compare symptoms, and check your family history. My mother had never been told that there was a genetic component to bronchiectasis, so she never knew to warn us about that. And now we know, and I make sure everybody in our family knows that lung disease runs in our family. Note the patterns of your symptoms, whether it relates to the time of the year, weather, work environment, travel, all those kinds of things. It also helps if you can bring someone to your doctor appointments. Study ahead of time for your appointments so that you have questions written down, ready to go for your doctor.